Hi everyone, welcome back to the channel. Today we're going to talk about something really important for anyone with diabetes, your eyes. Yes, your eyes. Most people think diabetes only affects blood sugar or maybe the heart and kidneys, but actually it can silently affect your vision too. And here's the tricky part. Sometimes your eyes can be changing without giving you any warning signs. You might be seeing just fine, reading clearly, going about your daily life, but there could already be damage happening at the back of your eyes in a part called the retina. So let's break it down in simple terms. How does diabetes affect your eyes? Well, when blood sugar levels are high over time, it can damage the tiny blood vessels in your eyes. These vessels are particularly delicate in the retina, which is the part of your eye that acts like the film in a camera. It's where light turns into the images we see. When these tiny vessels get damaged, several things can happen. There can be small bleedings, fluid can leak into the retina, swelling may develop, and in more advanced stages, new but abnormal blood vessels can start to grow. This condition is called diabetic retinopathy. Now here's a really important point. Diabetic retinopathy often starts without any symptoms. That means saying, "I see fine, my eyes are healthy," doesn't always mean everything is okay. Many people only notice a problem when it's already progressed. Signs like blurred vision, floating dark spots, flashes of light, or wavy vision are actually indicators that something has been happening for a while. And by the time you notice them, treatment might be more complicated and the risk of permanent vision loss is higher. This is where OCT comes in. OCT stands for Optical Coherence Tomography, and it's a super important eye imaging test. Think of it like an ultrasound for your retina, but using light instead of sound. It's painless, non-contact, and very quick, usually just a few minutes. The OCT scan gives your doctor a detailed, cross-sectional view of all the layers of your retina. That's especially important in the macula, the small central part of your retina responsible for sharp, detailed vision. With OCT, your doctor can detect early swelling, fluid buildup, or thickening in the retina, even before you notice any change in your vision. Why is this so valuable for people with diabetes? Because early detection is key. Sometimes a patient says, "I see perfectly," but OCT might reveal early macular edema or tiny retinal changes. Catching these issues early can prevent serious vision problems later. If you wait until you notice blurry vision or floaters, the damage might be harder to treat, and in some cases, vision loss can become permanent. So when should you get your eyes checked? If you have type 2 diabetes, the recommendation is to have a comprehensive eye exam as soon as you're diagnosed. For type 1 diabetes, regular eye exams usually start a few years after diagnosis, and your doctor will schedule these based on your age and how long you've had diabetes. But here's a simple rule of thumb. If you have diabetes, aim for a detailed eye exam at least once a year and include an OCT scan if your doctor recommends it. If any issues are detected, your follow-up might be every 6 months, every 3 months, or even more frequently depending on the severity. There are certain warning signs you should never ignore. Sudden vision loss, blurred or distorted vision, floating black spots, flashes of light, or seeing words shift when reading are all red flags. If any of these happen, don't wait. Contact your eye doctor immediately. Waiting and thinking it'll go away can lead to permanent damage. Now let's talk about the worst case scenario. If blood sugar remains uncontrolled for a long time, and if other risk factors like high blood pressure, high cholesterol, or smoking are present, diabetic retinopathy can progress to severe stages. The retina may bleed more, swelling can increase, and in extreme cases, retinal detachment may occur. This can lead to permanent vision loss or even blindness, but here's the encouraging news. Most vision loss from diabetes can be prevented or slowed down if detected early. Controlling your blood sugar, blood pressure, and cholesterol, avoiding smoking, and attending regular eye exams are the most effective ways to protect your vision. It's also important to know that not all vision changes in diabetes are due to retinopathy. Sometimes, sudden fluctuations in blood sugar can temporarily blur your vision. That's another reason regular monitoring is important, so your doctor can distinguish between temporary changes and permanent retinal damage. Remember, diabetes affects each person differently. Some people may never develop severe eye complications, while others might see changes more quickly. That's why personalized care and regular monitoring are essential. OCT gives your doctor a clear, early look at what's happening inside your eyes and allows for timely treatment, whether that's laser therapy, injections, or lifestyle adjustments. So in short, if you have diabetes, don't wait for your eyes to give you a warning. Even if you feel fine and see clearly, subtle damage might already be happening. Make sure you have your eyes checked at least once a year, and ask your doctor if an OCT scan is right for you. Early detection is your best chance to protect your vision for the long term. Take care of your eyes. They're not just the windows to your soul, they're the windows to your world. And with the right care and attention, you can keep seeing that world clearly for years to come.